This incident has caused suffering for many. And again, I apologize for this.
Just 2 days after announcing the death of a 14-year-old in Alberta's COVID-19 numbers, Dr. Dina Hinshaw apologizing to the family and removing the teen from the COVID tally.
While the initial report of the death of the 14-year-old included COVID as a secondary cause, we have now received additional information that indicates COVID was not a cause of death. As we routinely do with all similar reviews, when this happens, we remove the death from our reporting.
Tuesday, Hinshaw had said the teen had a complex pre-existing medical condition that also factored into the death. Her comments widely shared online. Meanwhile, a social media post claiming to be from the family began circulating, saying while the teen had tested positive, but it was not the cause of death. City News reached out to the account behind the post Wednesday and has not received a response by broadcast deadline Thursday.
Some may make claims that there's information not being shared or that numbers are not accurate, and that's always a risk when we're transparent, because being transparent and timely means that we will need to make adjustments, because the information that comes to us initially sometimes does get adjusted over time.
Well, it's one of the most public changes in COVID-19 death statistics. It's not new. In an interview with an infectious disease expert on how COVID-19 deaths are reported hours before Hinshaw's announcement,
the medical officers of health do actually review the cases, and so sometimes you'll actually see the numbers change a little bit. When on deeper review, they say, no, that doesn't count as a COVID death, but they look at the death certificate. Sometimes they do case review. And it does have to be, something that is attributable to COVID.
Dr. Hinshaw clarifying these cases are rare, but moving forward, they will only report the death of a minor after a secondary review, and asked how people can trust the data that exists following this mistake.
I would say that the process that we follow takes very seriously the responsibility of ensuring that the deaths that we report do have COVID as either a primary or secondary cause. So if someone dies from a car crash or another cause that is clearly not COVID, they are removed from our deaths and they are not counted.
Saying a primary cause of death would be a condition like pneumonia, while a secondary would be when COVID-19 makes a condition like heart failure or any other pre-existing ones worse. In Edmonton, Carly Robinson, City News.